Hello, my name is Ehtisham Ahmed. I am a clinical research fellow at the University of Leicester. We know that the holy month of Ramadan is fast approaching. It is a time of great excitement and religious fervor for millions of Muslims all over the globe who will be fasting from sunrise to sunset for one full month. According to the teachings of Islam, type 2 diabetes, like many other chronic conditions, can be regarded as an exemption from fasting, but many of you will still choose to fast. As your healthcare providers, it's our responsibility to respect your decision and support you navigate successfully through the period of fasting. I will now be answering some of the most common questions related to fasting and type 2 diabetes. Can I fast? As discussed earlier, type 2 diabetes, like many other chronic conditions, can be regarded as an exemption from fasting. However, if you choose to do so, you should discuss it with your healthcare provider. The ideal time to do it is about 1 to 2 months prior to start of Ramadan in what we call as pre-Ramadan assessment and counseling. During this appointment, your physician will not only perform some blood tests, including an HbA1c to assess diabetes control and other related tests like kidney tests, but they will also review other factors which may impact your ability to fast safely during Ramadan. We recommend that those of you who have got poorly controlled diabetes with an HbA1c above 86 millimole per mole or more than 10% in older units, they should not fast. Also, if you have got significant other underlying medical conditions like heart failure, kidney impairment, or you're having chemotherapy for an active cancer, you should not fast. Similarly, those undergoing an acute illness or involved in intense physical labor, they should not fast. Pregnant women and children with type 1 diabetes should also be regarded as an exemption from fasting. Also, the pre-Ramadan counseling and assessment provides an opportunity to discuss your current medications with your healthcare provider. Your physician may reduce or stop certain medications like insulin, which have a propensity to drop your blood glucose during fasting, also called hypoglycemia. This is particularly true if your blood glucose was relatively well controlled prior to start of Ramadan. Alternatively, they may switch you to other safer options. Can I continue to use SGLT2 inhibitors and GLP-1 receptor agonists during Ramadan? So SGLT2 inhibitors and GLP-1 receptor agonists are relatively newer classes of drugs which are not only beneficial for blood glucose control but have also been found to have a beneficial impact on the heart and kidneys. They also cause weight loss and they have a very low risk of dropping your blood glucose. Hence, as a result, we are seeing a lot more patients on these medications. These medications have also been found to be safe for use during Ramadan, and hence we suggest that if you are already on those medications, you should continue taking those medications. However, we do not recommend starting those medications immediately prior to the start of Ramadan or during Ramadan, as SGLT2 inhibitor use is associated with the potential risk of dehydration, especially in warm, hot, humid climates or those countries where the fasting hours are long. So we advise that you should drink extra fluids during the permissible hours, especially after iftar. The GLP-1 receptor agonist may be injected once a day or once weekly, depending upon the formulation that you are using. The most common side effects associated with their use are nausea, vomiting, and abdominal pain. So if you experience any of those side effects, you should speak to your healthcare provider, who may either reduce the dose of the medication or stop it altogether for use during the Ramadan. Do I need to monitor my blood glucose, and when should I break the fast? First of all, it's very important to know that blood glucose testing does not break the fast. We recommend that all individuals with type 2 diabetes should monitor their blood glucose during fasting. However, it is particularly important for those who are on insulin or other medications which can drop their blood glucose. You should ideally test your blood glucose before sahur, 2 hours after sahur, midday, before iftar meal, and 2 hours after iftar meal. Those of you who don't normally test their blood glucose, we recommend they should also test their blood glucose midday and before the evening meal or iftar meal. If you find that your blood glucose is less than 3.9 millimole per liter or more than 16.6 millimole per liter, you should break your fast. The researchers at University of Leicester have been working on guidelines for management of type 2 diabetes during Ramadan. It is expected to be published around the start of Ramadan, and you can discuss it further with your healthcare provider. Just briefly about the COVID-19 pandemic in the end, we are all going through very unusual and difficult times. As an individual with type 2 diabetes, you have to be extra careful. We recommend that if you are not feeling well, particularly any signs or symptoms of COVID-19 infection like a cough or fever, you should break your fast. If you are taking medications like an SGLT2 inhibitor or metformin, you should stop taking those medications and ensure that you are hydrating yourself well. If you are not improving, seek help early. We all have to observe the social distancing measures that have been advised. It's likely that the mosque will stay closed and you have to observe prayers and fasting at home. We understand that it will be difficult as Ramadan is all about coming together and sharing like many other religious festivals. But as a responsible individuals, we have to not only look after ourselves, our family, but also our colleagues and community as a whole. Thanks for listening. I hope you stay safe and Ramadan Mubarak.